This is Dr. Nandini Nelivigi, a senior consultant orthodontist, Director Nelivigi Dental Clinic, Bellandur, Bangalore. Today we will talk about what is called excessive clenching of teeth or bruxism. Bruxism is a parafunctional activity wherein you excessively, unnecessarily keep grinding your teeth. Now, why does this happen? This happens basically, the most common reason why it happens is of stress and anxiety. Apart from that, you can also have things like malaligned teeth, some prominent cusps interfering with occlusion, or you can have a missing tooth, malalignment of teeth. All these also could be the reason why somebody is having a bruxism habit. Now, this habit is not something good to continue with, because what happens is it tends to wear off the enamel surface. Enamel is that part of the tooth which doesn't have any cells which can regenerate it. So once enamel is lost, it is lost forever. And once the enamel is lost, sensitivity becomes an issue. So even eating or drinking regular room temperature food, not hot and sour, sweet and sour, also causes this kind of sensitivity. So it is important that we maintain good health of the teeth. Now, when you meet a dentist, there are quite a few things that the dentist would probably ask. Now, if a person has bruxism habit, sometimes the clenching of teeth is so hard that even the person sleeping next to him can hear the teeth crackling against each other. And the patient otherwise, when he gets up, has some soreness of the jaw, muscular pain, a mild headache maybe, and situations like this are seen. So in any of these situations, we are more or less sure that there is a bruxism habit. We can also see wear facets on the teeth, because the upper and lower teeth are touching, grinding against each other. We can many a times see that a portion of the enamel would have been worn out, causing a wear facet. So what does a dentist do in these situations? One, if he sees that there is any occlusal prematurities which are leading to the cause of bruxism, then there are quite a few requirements that we clean or we reduce these high points and then make sure that the occlusion is good. If there is a missing tooth or occlusal malarrangement of teeth, then probably an orthodontic treatment to help reduce or help correct all this may be required. If nothing like this is seen and we feel that anxiety or stress could be the reason, what would be advised is definitely to go through some kind of a stress reduction pattern, learn some kind of a yoga or meditation which will help relieve you of the stress. You can also get into some kind of good regime, exercise regime, wherein you keep yourself well occupied through the day. You do not bite on anything other than your food, like say keeping a pencil in your mouth and keeping on biting over it. Things like that should be avoided. Drinking lot of caffeine related things like say coffee, tea, Coca-Cola should be avoided. Alcohol should be avoided. So these things can help reduce the stress levels and anxiety levels and all that, and help reduce bruxism on the whole. You may also be given something called a night guard, which is a soft splint material which is used to cover up your teeth. So the dentist may ask you to wear these aligners or wear these night guard and sleep. So what happens is, if you are continuing to have the bruxism habit, your teeth are actually occluding against the night guard, which is soft material, not against your tooth. So if at all something is wearing off, it is the night guard that wears off and not your tooth. What portion of the tooth enamel you have already lost because of bruxism, we cannot do anything about it to regain them back, but at least we can prevent further loss of enamel from happening. So a thorough investigation as to why or what has led to bruxism is important, because if we remove the cause, only then should the bruxism habit also go away. Please do consult a dentist and get yourself treated for bruxism, because loss of enamel and sensitivity becomes a very major issue to treat otherwise. Thank you so much.